My name is Dr. Pasha Mukherjee. I'm a doctor in the NHS and I'm also the current reigning Miss England. I started working as a doctor last August, so it's going to be a year coming August essentially. I took a break in between to represent England at Miss World, and then during the COVID-19 crisis I decided to come back to work, and I've been working since the pandemic hit in April. I started wearing glasses since I was 10 years old, and I started wearing contact lenses since I was in year 9, so it must have been about 14 or something. I've worn either ever since, to be honest. My eyes, I'd say, quite bad. You know, I can't really see your face properly if I took my glasses off. So I actually know a lot of people, including doctors, who wear contact lenses for a long time. For me, I wear them only during my shoots or events, and sometimes they do overrun the time that you're actually supposed to wear them for is about 8 hours, and you shouldn't be having a contact lens for longer than that. You need a contact lens free period for your eyes to readjust, and there's a lot of people who have very bad habits with contact lenses. It came to the point where in Miss World this year I had to wear glasses because I actually developed an eye infection on the first day because of wearing contact lenses for a long time. A lot of people don't wash their hands properly before putting contact lenses on. So you're introducing an actual, infection potentially every time you're touching your eyes with contact lenses on, and then when you're taking them off. A lot of the times people just shove their contact lenses in with their makeup and it all gets all gritty and grubby, and you're not aware of what's really going on in the microscopic level. In that case, the provision of laser really changes the game, that they don't have to rely on that ordeal of washing hands and doing it correctly, storing the lenses correctly, all these things. They can just have their vision normal. I think it's novel and it's life-changing. So I first started having dry eyes detected, probably had it for years. I never had a test done. I think it was last year. Contact lenses actually do make you have dry eyes. In fact, long wear of contact lenses can also perpetuate that. With modern lifestyles of continuously looking at screens all day, 8-9 hours a day potentially, you'll be surprised how many hours we spend on our phones. So all this was adding up for me. I use social media a lot, I use my phones a lot, I'm looking at screens a lot at work, and I wear contact lenses, have all these other factors in my life. Those did make my eyes really, really sore. I'm hoping with less contact lens wear now, that's going to change, and laser's going to help with that too. So I woke up this morning and I was really quite surprised. There was no pain at all, hardly. I went about my day. I just felt like a new person, just not having to reach for my glasses in the morning. Because I always feel that, to just function, to start my day, I always reach for my glasses. And I didn't have to do that this morning, which was just nice. I saw my face in the mirror without my glasses. I like that. It's remarkably better. I can see your face and I can see the writing on the wall. If I'm 100% honest, I still don't feel like it's happened. It all happened so quickly, and I can see your face. As I told you yesterday, if I took my glasses off, I couldn't see your face. It just doesn't feel like it's real yet. To think that I went 14 years of my life with the vision problems, self-esteem problems, and how quickly, within 10 minutes, 15 minutes even, if we say 15 years of my life I spent in a certain way, and in 15 minutes that was changed. I would absolutely recommend Optical Express. They've looked after me as a patient, as a client so beautifully. I've really enjoyed being here, and how accommodative they've been around my schedules, what's important to me as a client. That's been the most important, so woo, Optical Express. As a doctor, I feel that eye health is absolutely key to a person's functioning in society and general health, physical and mental. You know, we have seen a trend where people over a certain age, when they retire, when they're made redundant, they have a significant decline in their physical health as well. When they're unable to do things that are regular activities, so we're talking about things like doing a sporting activity, being able to drive, all these factors are affected. So eye health, I think, is absolutely key. In this time of COVID-19, we've been told time and time again by the government not to touch your face, not to touch your eyes. You directly introduce infections to your system by touching your face and your eyes. And with contact lens wear, you are doing that. There's a myriad of risks that are now there for a person to get not just eye infections, but any other, you know, viral infections, respiratory infections, just by touching their face and their eyes. We see a massive burden on the NHS as a, you know, aftermath of that lifestyle. In that scenario, you know, refractive surgery like laser eye surgery can be very transformational. It can really change people's lives and definitely impact our economy and the NHS in terms of the burden that eye health puts on it.